Here with my friend Secretariat, who's been here with me throughout my equine journey, and he's here to make sure we keep up the pace to get to the finish line in less than 15 minutes, so we'll try to do that. Have you ever heard of, or perhaps been personally affected by an outbreak of an infectious disease at an equestrian center, or a barn, or a stable, or a racetrack? Well, if you have, you know the magnitude of the disaster. If the infection isn't identified early enough and treated immediately, the result can be catastrophic, both in terms of the number of lives lost and the financial outcome of the matter. At Los Alamitos not long ago, 30 horses were euthanized because of the spread of a lethal disease. If it had been caught earlier, that would have been completely avoided, and there would have been a way to stop it, particularly using the invention you're about to learn about. After seeing hundreds of pitches over the years as a venture capitalist, it is only after great reflection that I can make a defensible statement that the financial outcome of this product will be in the hundreds of millions of dollars, if not more. What follows below is a video I made with the help of Dr. Joseph Bertone, a highly recognized equine veterinarian with worldwide experience over the past 40 years. Following discussion of how the product works, there is a demo of how it would be used, but for people, not for horses. So please take that into account as you're watching it and adjust your perspective accordingly. After the video, I will return to address many of the issues concerning EquineDX.
Okay. My name is Dr. Joe Bertone. I've been a veterinarian for more than 40 years now. I have written multiple journal articles. I have spoke in almost every country in the world where there have been international meetings. I've done well over 300 presentations. I have over 100 first author articles and book chapters. And what I'm here today to do is to talk to you about this, what I think will be a groundbreaking piece of equipment in veterinary medicine and really help the health of the horse and increase the ability of owners to own horses at a better price point and issue, as well as to reduce outbreaks, help with outbreaks of certain infectious diseases, etc., like nothing has ever happened in the past. And one of the things was I moved to Colorado to basically, kind of do the things I wanted to do, and then a friend put George in touch with me, and I decided to help George do this. What happened is that 40 years ago again, someone told me that someday we would have this technology, and I told them it would never happen. That's what drew me out of my time in Colorado to come and help get this done. And what this unit does is it provides a diagnostic technique next to horses that's probably the most landmark thing that's been done in as far back as I can possibly remember. Maybe the second thing behind this would be ultrasound and radiology done in the field. Basically with this, one of the biggest problems veterinarians have, especially equine veterinarians, is that they work in the field, they collect their samples are sent to laboratories to be analyzed, and it could take days to get results. We can see this when we have closures of facilities like Del Mar Racetrack, where we're at right now, that we had to wait for results before you could move on a horse, or a horse could move out of Del Mar or whatever because of an infectious disease. And this happened at Santa Anita, and it's happened in multiple racetracks and stable facilities across the country. So what I can do really simply is, rather than collect the sample, put it into, go back to my office, have it sent off, wait a week for a result, and that result costs much more money. What I can do is take the horse, I can draw a blood sample, I can do a nasal swab, I can grab some feces, load it into a cartridge, put it in this machine, and have an answer in 20 minutes, which makes a huge difference for veterinarians. We were recently at the equine practitioners meeting. We interviewed several people who said the same thing, that this would be a landmark, because again, I can do this horse side, I can apply therapy. Versus in the past, I have to take that sample, it takes days and days to get the result, then I have to come back. So the owner spent quite a lot more money, and also the horse has gone a period of time without treatment that it ought to get other than the emergency treatment that it needs. So I'm really glad to help this project. One thing that's really important, obviously, is income, and we don't talk about those things that often, almost as if we're embarrassed about it. But the reality is if I took a nasal swab for this horse, sent it off to not counting anything else, the test alone would cost me almost $100 for the test. And that doesn't include the time to pack, the shipping, and everything else. And so usually a doctor has to break even, has to charge somewhere in the area of $175 to get one sample done.
Omnibox changes the way you care for your family. What do you do if one of your children wakes up feeling sick? In a world of heightened contagion, do you keep all of them home? In order to know what the problem is, you'd have to go to the doctor, potentially be exposed or expose others to a virus, get a test, go home, and wait a couple of days for a result, if you could even get a same-day appointment. Omnibox is your affordable, private, at-home platform. Purchase the box, then just go to the drugstore and pick up the cartridge that's specially engineered to treat the infectious disease you're concerned about. Then simply walk into your bathroom and pop in a cartridge. Open the app on your phone to verify and run the test and get a result in 15 minutes. Through your app, you can send the result to your doctor immediately, who can decide what you need. Then just pick up or have your prescription delivered and you're on your way to recovery. So, how does Omnibox work? We combine standard microfluidics with the most inexpensive amplification technique. This combination produces the least costly way for the cartridge to interact with the instrument. We can't disclose all of our secret sauce, but it embodies a unique configuration of reagents. Our reconfigured system allows us to develop any test in no more than 4 months, so we'll be able to be responsive to any new condition that appears. In the case of COVID, antigen tests typically can't detect the virus for the first 2 days, which are high in contagion. Our nucleic acid amplification test lets us amplify the targets billions of times, allowing us to detect a very low viral load at its earliest stage. Yesterday, we had to go through waiting, testing, and inconvenient and expensive office visits just to find out if we had a virus. Tomorrow, with your partnership, we will use Omnibox. We're at the forefront of the movement to empower people to make their own medical decisions. Join us to develop a better tomorrow.
I hope we can agree that what you've just seen represents the perfect solution for this very real problem. To achieve this goal, I've assembled a team of world-class experts in the field of molecular diagnostics with expertise in assay development, experience in the distribution of veterinary products, an equine attorney and racehorse owner, and a patent attorney who has represented 8 Nobel Prize winners in the field of molecular biology, in which she also holds a doctorate degree. As I mentioned above, the problem is that horses live in close quarters, and the diseases such as equine herpes, salmonella, respiratory infections, and others all traverse swiftly throughout the facility. As Dr. Bertone discussed, the problem is one of timing of diagnosis, cost, and ability to treat the animal with the proper therapy. The repayment of stud fees for miscarriages caused by equine herpes, depending on the value of the horse, could reach up to $200,000. And there are hundreds of horses at racetracks and equine centers around the country and around the world where this type of infectious disease can spread. And today they are not routinely tested. And tomorrow perhaps they could be. In 2021, even the World Cup needed to be canceled due to the deaths of 17 horses and hundreds were infected with equine herpes. In 2022, the Denver's International Horse Park needed to be closed for an entire month with an actual financial impact of more than $40 million. So wouldn't it be a good thing to test? Why is our solution the right one? It's very easy to collect the sample and put it in the cartridge rather than go through the many steps that the equine vet otherwise must do today. The instrument is small, roughly the size of a toaster, but none of this would be important if we weren't able to produce this very affordably, and we can. The test results not only allow the equine vet to treat the animal more rapidly, but they also provide a revenue stream for him that didn't exist before. This is because our system replaces the need for the lab for this type of testing, and the price point at which we can deliver the product and the cartridge to the doctor gives him plenty of upside to sell the test to the end user and still undercut the cost of what it would otherwise be. And his product is a gold standard quantitative analysis delivered on the spot in 20 minutes. What horse owner wouldn't prefer that to the way it is today? I want to emphasize that this instrument and the cartridge are not new technologies. That would involve a much higher level of risk and many millions of dollars more than we are asking for to accomplish this objective. And due to the fact that there is no FDA requirement for this type of testing, we can produce a working prototype for somewhere around $10 million, which would be double or triple that if we were going for a human target first. The prototype should be finished in a time frame of 12 to 24 months. And what we've done is created a novel reconfigured workflow of the way this process works. Our patents have been filed around this, and we've received freedom to operate analyses that can't be disclosed here, but they all provide the protection we need to assure the outcome we will remain the lowest cost provider without infringing on anyone else's intellectual property. That's what our reconfigured workflow does. If you'd like to compare the magnitude of this invention to that of other transformative ones, I've included just a couple. The first shows that once upon a time we had a printer that was huge and took a lot of space. Then the inkjet cartridge was invented, and now we simply put it in and we get a result from the small little printer. Another example would be the glucometer, where we had used to need to send blood to a lab. Now we have the little glucose reader and the test strips, which are the disposables. This is exactly parallel to our situation, where we take a cartridge and put it into the instrument and read it instead of waiting to send things to a lab and getting an answer. Of the infectious diseases which are of great concern to the doctor today, the neuro panel and the respiratory panels are the most often tested. So our plan is to create those panels as our first products. Before I got started with this venture and undertaking in earnest, I wanted to be sure that this product would really be helpful to the equine veterinarian. To that end, I received a letter of support from a group practice of equine vets in Aiken, South Carolina, with whom I met, and they determined that yes, indeed, this would be very useful to them, and so their testimony appears on the slide. I also walked the trade show floor at the American Association of Equine Practitioners in San Diego last December, and I got nothing but positive feedback from every equine vet and company that I spoke with, period. While there are other systems that exist that try to tackle this problem, they don't do so in an efficient or cost-effective basis, which could be of real use to the equine vet visiting his patients, period. So the ultimate question is whether or not we are patentable and whether or not the engineers can make and design the product to produce a working prototype. As I mentioned above, our patent lawyer has represented 8 Nobel Prize winners, and she has given us freedom to operate analysis, which says that we are good to go and we won't infringe anyone else's intellectual property. I also approached a design engineer, which has extensive experience in the fields of microfluidics and injection molding. Their conclusion is that they're confident that they can produce this product as designed within 2 years. So how big is our potential market? There are approximately 20,000 equine vets around the world. We assumed we might reach 70% of them in time. We also assumed that maybe 15 horses per day would be seen of which maybe 5% would be suspicious enough to justify making a test. This produces a revenue stream in excess of $200 million a year with very little cost because the high gross margin is very high, and we should be in a position to deliver a substantial value to the company, well in excess of into the hundreds of millions of dollars, if not more. Many would elect to build this out to its fullest potential. I don't. I firmly believe that any number of potential acquirers can manufacture the instruments, the cartridges, and market on far more advantaged economic terms than we could. What is important for us is to make a working prototype for several assays within 24 months and hand it off to the highest bidder, of which I expect there will be no shortage. It will be important for the company to establish key relationships with several large equine organizations. I would like to do this so that the horse owners can also learn about our product, so that when it comes time for the equine vet to tell them that they want to use the test, they will have already heard about it. In summary, I think the key takeaways should be, first and foremost, that this changes for the better the ability of the equine vet to treat his patients. If that weren't the case, there would be no use for this. I don't think there can be any argument about the fact that we do in fact change that. The system saves important amounts of time and eases the burden of the equine vet as well. It also provides him with an important new revenue stream which didn't exist before. From an investment perspective, this is the recession-proof product, one with great gross margin but with a built-in market which requires very little money to attract customers. And lastly, the rate of return can be exceptional and swift. I welcome your inquiries and potential investment interest about this exciting adventure. Thank you very much for your time.